Hello, mommies. Hello, everyone. Hope you ladies are doing well. Hope you all are doing well. It's a beautiful day. It's weekend, and we thank God for life. So today we are rounding up with our birth defects month. It's the last Friday of the month, and we'll be rounding up with our birth defects. I'm so sorry to be this late, but things happen, right? I apologize, and it is the reason why I won't be staying here for so long. I'll jump right into the topic and talk about it, and we get out of here. Please, if you're around, please leave a comment so I can acknowledge your presence because I can see one person viewing. So I can acknowledge your presence before we start. So please, if you're around, please leave a comment so I can say hello to you and I know I'm speaking to you before we start. Okay? So today we are going to be talking about another birth defect, which is clubfoot. It's extremely common. It is very, very common. That is why we decided to talk about it as one of our topics for birth defects. Thank you so much, Christelle, for being here. Thank you so much. Thank you so much for being here. One of our top fans, and she's a wonderful lady, a spectacular one, very hardworking and a brilliant lady. Thank you so much for joining me today. So I'm going to go right into the topic and not waste anybody's time. Let's just talk about it and get done with it. Clubfoot is a birth defect, like all the other ones we've talked about. We've talked about spinal bifida, cleft lip and palate, and one other birth defect like that. So today we're talking about clubfoot. What is clubfoot actually? So I'm going to be talking about the definition, the types, the causes, the signs and symptoms, and risk involved, and the treatment as well. And then I'm going to be giving you some facts about clubfoot. So we'll get right into it. Clubfoot is a birth defect which is very, very common, as I said before. I'll just go into some facts about it before I get right into it. First, clubfoot occurs in 1 out of 750 babies, unlike the other birth defects that we've talked about that occurs in 1 in maybe 1,000, in 2,000, in 4,000. This one actually occurs in 1 out of every 750 babies. And if you consider that babies are being born every second, then you will know that it's something which is very, very rampant. And it is the most common birth defect, which affects the feet. It is also said that 80% of clubfoot cases are usually seen in the developing world, like our country that we are in, mostly in Africa. It is also common in firstborn children. So if you are a mother who is still thinking of giving birth to your firstborn, please take caution so you don't fall in this category of maybe mothers who give birth to a child with clubfoot, because the aim is to give birth to healthy children. The aim is to have a healthy baby. The aim is not just to be a mother, but to be the mother of a healthy baby, because you being a mother takes a lot of your time. Then imagine you being the mother of a baby who has a defect. Like, the hospital becomes your new home. Like, you have to stay there until the baby's case is rectified before you can leave. I can see another person. Please indicate with a comment so I can acknowledge your presence. And please don't forget to share the video. So I was talking about it being very common with firstborns, and also 50% of clubfoot cases affect both feet, though most times it affects a feet. Like 50% of the times it affects just one leg, and in 50% of the cases it affects both of the feet. So that is it. Those are the main facts about clubfoot. Sorry, clubfoot. I'm talking about clubfoot and I'm thinking of cleft lip and palate. That's why I'm calling that so. Oh, Mr. Ayoketa is here. Thank you so much for joining. Let me not talk so much about him. Okay, I was talking about the definition before I jumped into some of the facts that we should know. I'm sure you saw the flyer of clubfoot. Have you ever seen someone with that kind of condition, maybe a child with that kind of condition? Because it is mostly very common in Africa. It is mostly common in developing countries. So now, as I said before, it is a birth defect that affects the foot of the baby and makes the baby's leg to kind of rotate inward, making the baby to walk in a particular kind of way. It's like a curved leg, but a more severe curved leg, because it's not just the knees that kind of tilt, but their ankle and other parts of their lower leg tilts inside, making the baby to sometimes walk with the side of their leg or the back of their leg. So now I'm going to be talking about some causes of cleft foot. Some causes may include the position of the baby in the womb. The position of the baby in the womb can make the baby's leg to kind of coil. You know that if you keep something in a particular position, like any part of your body, if you keep it in a particular position for too long, it takes the shape of that position which it is. For example, when you realize that you're wearing a watch for too long, if you're wearing it too tightly, you realize that part of your hand starts shrinking inside. So the position of the leg in the womb might make the baby to have club foot. But this case is not that severe, as it can easily be arranged. Like even with the mother arranging it and massaging it with the hand, it can be arranged. Also, another cause is genetic conditions. So different genetic conditions can cause club foot. Actually, the main cause of club foot has not yet been discovered. They are still doing a lot of research on it to know what actually causes it. But these are situations that might cause it. So these are not the main causes. As the main cause, like the one thing which actually causes it has not yet been discovered. So environmental factors also, like maybe a mother smoking, drinking, or taking drugs during pregnancy, can lead to you having a baby with club foot. So we just have to be very cautious. If you are a mother, you're thinking of giving birth, please be very, very cautious, because as I said before, the aim is for you to have a healthy baby. The aim is for you to be the mother of a healthy baby and not just a mother. Hello, Lady Scholar. Thank you so much for being here. I can see like 4 more people have added. Please, if you're around, please indicate with a comment, leave a like. Don't forget to share the video, because us mothers need to know about these things. If you don't know about something, you can't fight it, right? It's until you have an understanding of certain things, that is when you can actually contribute to eradicating it or making yourself not to go through that kind of thing. I can see Lady Joanne. Thank you so much for being here, Lady Joanne. Okay, I talked about 3 causes, which is the baby's position in the womb, genetic problems, and environmental factors. I would like us to note that the main cause of club foot is not yet found, as scientists are still doing their research. Most of these birth defects, the main cause, like the one thing which causes it, for example, we can say malaria, we can say mosquitoes cause malaria, right? We know that it's mosquitoes, they are coming from mosquitoes. But for this birth defect, the main cause, like one thing which you can call that, okay, if you eradicate this one thing, then it will not happen anymore. For example, if you keep your environment mosquito free, you won't have malaria. But there are times which you can still do these things which I mentioned as the causes and not have a baby with club foot. That is why I'm saying that the main cause has not been found. So I can see Lady Christine Mengo. Thank you so much for joining. Don't forget to like and share the video. I'm going to go on to talk about the types of club foot. So the first type is idiopathic club foot. This type is not so severe, as it can be adjusted by massage, therapy, and all. This one, they don't need to do a surgery, though doctors who are involved in club foot claim that a surgery is not the best way to adjust the club foot, as there are other simpler ways of curing it instead of making the babies go through that much pain. So idiopathic is the first type of club foot, which is the foot turning inward, but it's not very severe. The next type of club foot, which is also not very severe, is the position club foot. This is the type which I mentioned in the causes that can be the cause of the baby having club foot. So position club foot depends on how the baby was positioned in the womb. If the baby was in breech position when it's almost time for the baby to be given birth to, the baby will normally be born with club foot. And in this case, as I said before, it can easily be adjusted by maybe hand massage or anything which is not very severe. Now, syndrome club foot is the third type of club foot. which is very, very severe because it is mostly associated with another kind of defect that the baby has, which is what caused the club foot. So it is the same thing. The leg is tilted inward. And this one, the leg is almost from the beginning, from the time which the baby is born, the leg is really, really tilted so badly inward, which would take a lot of work for it to be straightened. Most times, these are the cases that are referred to undergo surgery. Now, syndrome clubfoot can also be caused by spinal bifida. Because as I said before, spinal bifida, in our spinal bifida video, if you've not watched that video, please go ahead after this and try to watch it. Because spinal bifida, as I said, can lead to disabilities in the child. So spinal bifida can lead to syndrome clubfoot, which is a more severe type of clubfoot, and you will need a severe kind of treatment for it to be okay. Now, those are the types. I'll move on to the signs and symptoms of clubfoot. The first thing is that the leg which is affected, if maybe the baby has it on one leg, is usually smaller and weaker. So the muscles on that particular leg will not be as strong as the one on the other leg, usually smaller, weaker, and shorter compared to the other leg. So that is one indication. That's one thing that you see and you know that this baby has clubfoot. The second thing is the tendons, which is the veins in that leg, in the lower part of the leg towards the ankle, are very stiff. So they cannot move freely. That is why the leg is curved in that particular kind of way. They cannot move freely compared to maybe if the baby's leg was in a normal position that the leg can really move. On the leg with clubfoot, the lower part of the leg cannot really be that mobile. So the next thing is the foot remains twisted. For example, a normal person can twist the leg inside and then twist it back outside. But for this particular leg, it's twisted inside and there's nothing you can do. There is nothing the baby can do to twist it back to the other way for it to be normal. So it has to take some form of treatment for that to be okay. Now, the heel of the leg, instead of pointing downward, the heel of the leg, instead of touching the floor, is pointing downward. You get right? So the leg is looking in an abnormal way. If you looked at the flyer which I posted, you will really see how the clubfoot looks. And the toes, the toe of the leg, instead of being flat, is pointed inside. So those are some signs of clubfoot. Clubfoot is, first of all, we need to know that it is not a defect which is painful. Like it might not be painful for the child. The beginning of it is not painful. It might not cause any pain. And a child can go on with it, with their normal life very well. But when it is not treated, now, this is what I'm going to be talking about, the risk and the complications. When it's not treated, these are the things that can happen, which is the reason why if a child has clubfoot, it's very important that it is treated early enough. In most hospitals abroad, like the ones I saw online, they treat it immediately the child is born. And I'll talk about the methods which this is treated. The first thing which, the first risk and complication which might come up is there is limited movement. So the child cannot move as freely as other children. And for the child to walk, the child cannot walk as fast as other children. Maybe a normal child would take maybe 9 months, 10 months or a year to walk. A child with clubfoot will take a longer time to walk because of that deformity in the leg. Also, shoe size is affected. A normal child, you probably need to go to the market and buy one particular shoe size for both legs, which is what is normal. But with a child with clubfoot, if the child has it on one leg, it's very, very complicated because if you, the mom, goes to the market, you need to buy the leg without the clubfoot will have a normal size, and then the leg with the clubfoot will be a little bit smaller. So you need to buy 2 pairs of shoes, a smaller size and a bigger size, so that it can fit in both legs. So also, it is also said that without treatment, without early treatment, if the child grows up with it, there is a high rate of that child suffering from arthritis in older ages. Also, the child might not be able to walk normally. Normally, if you look at the child's leg as it is, it's not down low as our legs are. It's kind of curved like this inside, such that the child is actually walking with this particular area of the leg, which could be very painful, like that part of your body touching the floor, because our soles are made in a kind of way that they can feel the pressure of the floor and they won't feel bad. But if your skin is what is touching the floor, then it can also lead to sores an abnormal walk, the abnormal walking style can lead to sores and make the calf muscles not to grow well. So those are some complications and risks that are involved with clubfoot. Apart from the fact that it is not something which can maybe give some discomforts or other things, clubfoot has this risk and complications. Now, for treatment, there are three main types of treatments which are normally carried out. For now, it is claimed that the Ponseti method is the most reliable one because it doesn't need for the child to maybe undergo a surgery, but it works. They claim that it really, really works and it has helped a lot of children. They have a percentage of 94% success with the Ponseti method. The Ponseti method was created by Dr. Ponseti, a doctor who studied about how the leg, that part of the leg, how the bones in there and the tendons and all the things in there function. So he could come out with this method. In this method, they actually put a calf. I'm sure as mothers here, we have seen when a child breaks the arm and then they'll put that thing on the arm to make the bone to join again. So that is typically how the Ponseti method works. So the doctor massages the leg and then puts that calf. They usually start it when the child is very young, maybe the first week that the child is born. They put the calf and it stays there for a week and then they remove it, massage again and put it back. So it is a method that takes a lot of time and they have to monitor and make sure that the leg is going to the right direction. So if the leg was curved like this, they try to straighten it and then put the calf so that the leg can get to the right position. Now, the second method is the French method. I don't know why they call it the French method. Probably it was discovered by a French person. That is why it is called the French method. So in this method, it is mostly physiotherapy and massage that is usually done. So they massage the leg from time to time, and it usually takes from 6 to 12 months for this particular method to be done. The last method is by surgery, where the child is taken into surgery. That leg is actually opened and then it is adjusted. Yeah, the surgery one is really complicated and it can lead to the child facing a lot of pains and all, but it is not done with the child up. So that's a good thing. So I've talked about the definition, which is a bed defect which affects the foot and makes it turn inward instead of it being the normal way that it is supposed to be. I've talked about the types, which are idiopathic, clubfoot, position clubfoot, clubfoot. I don't know why I keep saying clep. I'm thinking of cleft lip and palate. Okay, I've talked about the types, which are idiopathic clubfoot, position clubfoot, and syndrome clubfoot. I've talked about the causes, which are baby's position in the womb, which is what leads to position clubfoot, genetic conditions, which is what can lead to syndrome clubfoot, and environmental factors. So I've talked about some signs and symptoms, which is that the leg is slightly smaller, shorter, and weaker compared to the other leg. Tight tendons, the foot remains twisted, the heel points downward, and the front of the foot turns inward. So those are some of the things that I've talked about. I've also talked about some risk factors, which is that movement is limited and slow. Also, shoe size is affected. The next one, without treatment, there is very high risk of arthritis in the child when the child grows up. Also, the child is not able to walk normally. And lastly, the abnormal walking style may lead to sores, and the growth of the calf muscle is retarded. Now, I'm going to go on to some other important information which we are supposed to know about clubfoot. With all that being said, so I asked earlier when we started this video if anyone here has seen a child with clubfoot before. If you saw the flyers that we put on our Facebook page, you know how a clubfoot looks and you'll be able to identify if you've seen a child like that. Have you seen a child like that before? Let us know in the comment section, and please don't forget to share the video and leave a like. It's very important to us. Okay, now somebody might ask, how can clubfoot be diagnosed? Around 20 weeks or more, clubfoot can be seen through an ultrasound. That is why I always advise, if you're pregnant, ultrasounds around here are not that clear, but do as much as you can to do your ultrasounds. Go for your antenatal care, because it's from those things that they'll send you for an ultrasound, and you'll be able to know if your baby has a birth defect, and prepare your mind for it, prepare your pocket for it, because there is no birth defect that I've seen, considering the ones that we've talked about and the other ones I've read about. There is no one which is cheap to fix. So it is good for you to do your echography. Visit your doctor from time to time. Be your doctor's friend, so that if you have such a case, you can easily identify it, prepare your mind, prepare your pocket, prepare your lifestyle. Because giving birth to a baby, as I said before, changes your life totally. Your life changes totally. And then imagine giving birth to a baby with a birth defect is just something else. So those are some things which we need to consider. Please try to do your echography from time to time, because it can be diagnosed through echography. And then it can also be diagnosed after the baby is born. Like it can be seen when the baby is born. So those are the main things that I wanted to talk about on clubfoot. Clubfoot can be explained very, very simply, and it's not so complicated. But we have to try as much as we can. Eat our fruits if you are pregnant. Stay healthy if you're pregnant. Before you're pregnant, do these things. Stay healthy. Take care of yourself, because your baby being healthy depends on you. It depends like 90% on you, the mother, on the things you eat, on the activities you do. So please, let's be responsible for our babies. So right now, I would like us to talk about our Inyango Mom's quiz. Normally, I'm supposed to announce the winners by the end of our Friday live session, which I'm going to do now. But I did not talk about one thing: prevention. What can you do to prevent clubfoot? I'm trying to attack all the areas where your questions can come from before you start bombarding me with questions. So for you to prevent clubfoot, since the cause is not yet known, it's difficult to tell you that do this one thing and then it's going to stay, you're going to not have a baby with clubfoot. What we can advise is that you stay away from harmful substances, things like alcohol, drugs, smoking. Just stay away from those things, and it will give you a greater chance of giving birth to a baby who is healthy. So now, on to our quiz for yesterday. Some people answered. Our quiz has been really slow these days because our mothers are very busy these days too. And then we have not had sponsors to motivate our mothers to answer our quiz. So our quiz is getting a little bit slow. But I have wonderful news for you. Our quiz for next week has a sponsor, and our mothers are going to be winning some beautiful prizes. I'm going to tell you about it on Wednesday. You're going to find out who the sponsor is on Wednesday, and the prizes which are supposed to be won. Maybe Tuesday or Wednesday, we are going to try to put a post on that. So please do not miss it. So now I'll try to go on and announce our winners. Our quiz for yesterday was kind of complicated because the answers were not quite right. So they were, I can say a lot of them were 50% right, but we didn't get any answer which was 100% right. And I don't know if it is the term we use or what, I don't know why, but I'll just announce, considering the people who participated and how good they did. So first, 3 people participated. That is Lady Giselle Itala and Lady F4C Body Lawson and Lady Jam Meekness. So from the 3 people who participated, 2 of them attempted both questions. It's one question, but it had 2 parts. So 2 of them attempted the 2 parts of the question, and 1 person attempted just 1. So for this edition, we are going to be having just 2 winners because the 3rd person did not complete her answer. So the first winner is going to be Lady Giselle Itale. She's so consistent. I like how consistent she is. And looking at the fact that she's in the developing world, she's in the developed world actually, it would seem like she would not be so interested about these things, because for them, they educate them about these things in their hospitals very well when they are pregnant. But in our case, us who are in Africa, in the developing part of the world, which we don't really have a lot of these resources. I don't know why we're having cold feet to come and learn. Please, mothers, we are responsible for our kids even before we give birth to them. Have that in mind. And please, if you see a place which you can learn one thing or the other, please do. So Lady Giselle Itale is the first prize winner, and Lady F4C Body Lawson is a second prize winner. Both of them by next week are going to be sponsors. So you see, the people who sponsor the quiz believe so much in it, and they are even participating on the quiz. Try as much as possible to participate if you are here, if you're watching this video, because it makes the learning fun. Like, if you know you have to answer a question, it motivates you to participate. Like, if you know you have to participate, rather, it motivates you to learn. And when you learn these things, don't keep it to yourself. Teach someone out there. Tell a mother about it. Like, ask your mother, have you heard about this thing? Have you heard about this? You try to explain it to them a little, because I believe that the best way to learn is by teaching. That's why you see me here every Friday. That's why you see us posting things every day on our Facebook page, because the highest way to learn is by teaching. And if you're here and you're learning something, don't keep it to yourself. Because once that you keep it to yourself, you are sending an indication to your brain that it's not that important. But if you keep talking about it, your brain gets the notification that that thing is important and they store it, such that you can help someone out there. Because you never know when someone needs help. Women are going through a lot, and if you can educate somebody on something, it can really, really help them. So that is going to be it for today. I'm just going to try to go through everything I've talked about, because I know this video is going to come up someday and people are going to be asked to answer questions about it. So I'm just going to go through everything, and I'll try to summarize, because sometimes watching these 30 minutes 50 minutes videos is so time consuming, and not all of us might have the time. I'll try to summarize the 4 birth defects in one video and put it on our YouTube channel. If you're not yet subscribed to our YouTube channel, please just go to YouTube and type in Yango, and we'll obviously pop up. We have the same logo we have on our Facebook page, so type our name and you'll see us, and subscribe to our channel, because we are going to be putting a shorter video there on these birth defects, and you need to be aware about them. If you're hoping to be a mother someday, if you're hoping to be a parent someday, if you're an uncle, you're an auntie, you need to be aware of them. So I'll take cleft foot again, like a summary of all what I talked about today. So I talked about the definition. Cleft foot is a birth. Why do I keep saying cleft foot? It's club foot, please. It's club foot, not cleft foot. I'm thinking of cleft leaf and palate. That's why. I'm sorry. So club foot is a birth defect where one or both legs are located inward or downward. Most times it affects the affected leg is smaller. So, and hey, I forgot to say this. Cleft foot affects mostly male children. Mostly it's more common among boys than girls. So I've just talked about the definition. I'm going to talk about the types, which for the types, the first one is idiopathic clubfoot. The second type is position clubfoot. The third type is syndrome clubfoot. My light is failing me, but I have to finish this before I leave. I didn't bring my light out today. So for the causes, you have 1, the baby's position in the womb. Number 2, genetic conditions. Number 3, environmental factors. But we have to know that the main cause, like the one main thing which causes clubfoot, has not still been discovered. For the signs and symptoms, we have the affected leg is slightly shorter, smaller, and weaker. There are tight tendons. The foot remains twisted. The heel points downward and the front of the foot turns inward. Those are some signs and symptoms of clubfoot. And risk and complications are movement is limited and slow. Also, shoe size is affected. Number 3, without treatment, the child with clubfoot is more likely to have arthritis when they grow up. Number 4, the child may not be able to walk normally. Number 5, a normal walking style um, may lead to a retarded growth in the muscles around the calf, and it might also cause foot sore since the baby walking on that particular position is the skin which is touching the ground. So for treatment, we have the Ponseti method, which was created by Dr. Ponseti, the French method, and also surgery. So those are the things which you can do to treat clubfoot. And also for a prevention, what you can do to prevent clubfoot is stay away from harmful substances. Do not take alcohol while you're pregnant. Do not smoke or take drugs. Just try to live a healthy lifestyle. Please, if there is, I can see someone around. If you have a question, please leave your question so I can quickly answer it before my light actually gets dark on me. So if you have a question, I'll just give a minute for you to ask your question. If there are no questions, then it's going to be goodbye from me to you. So I'm waiting for your question if you have one, or your suggestion or your contribution, because I'm not talking alone. At least there's somebody here. So what do you have to say? Say something. Say something so I don't give up on you. Okay. I said I was going to give a minute. And it's almost a minute. If you have a question, please drop your question so I can answer it before I leave. My light is not the best today, so I want to leave here fast. I don't want to blind your eyes. Do you have a question? If you have a question, please ask. If you don't have any question and you understood everything, yay, that's beautiful. So, okay, it's been a minute, and I would assume that you don't have a question. I would just like to go ahead now and thank everyone who made it here today. I'd like to thank Lady Christelle Alor. Thank you so much for being here. I'd like to thank Mr. Ayok Eta. Thank you so much for being here. I'd like to thank Scholar Tinti. Thank you so much for being here. I would like to thank Lady Juan, and I would like to thank Lady Christy Mengo. Those are the people who commented. So those are the people that I saw. Thank you all so much for being here. And do have a beautiful evening, and may God bless you all. I pray that we don't have kids with clubfoot. And let's continue to try. Oh my God, Lady Giselle just came in when I'm about to leave. Hello, Lady Giselle. Hope you're doing well. I've already done with all I wanted to talk about, but it's better to be late than never. Thank you so much for joining today. So do you have any questions on clubfoot, Lady Giselle? I can spare a minute or two for you. Do you have any question on our topic for today? I've said a lot. I don't know if you caught them, if you got what I said, but if you have any questions, I'll be glad to answer. But if you don't have any questions, then I'm going to be leaving here because okay, I talked about the courses earlier. I'm so sorry you're having a busy day. First, it's good for us to know that the main causes, like in the other birth defects, have not yet been discovered as research is still being done. But some of the things which are associated with clubfoot, which are associated and are regarded as causes, the baby's position in the womb. So if the baby is in the breech position, for example, it can make the baby's leg to coil in a particular way, which can be fixed very easily. Also, genetic conditions and environmental factors. So mothers who drink, smoke, and don't have a generally healthy lifestyle will have a greater chance of having clubfoot. So those are some of the causes. Any other questions? I would be happy to go on fast and quick with the answer for you. Any other questions? I'm waiting on you right now. I would just like to drop this. Please, mothers, if you have any topics that you want us to talk about, right, don't hesitate to drop them. Drop it. We've taken a full month to talk about birth defects. We can take I didn't see Lady Giselle just asked that, can milk intake boost its remedy? Now, in most cases, children with clubfoot, children who are born with clubfoot, undergo the procedures to fix it immediately after birth. So the doctor examines the leg. If they are using any of the methods, it usually has to be done immediately after birth, so it can be fixed, and the baby is usually put in a calf, or they are put in some kind of shoes which are created to adjust the legs. So in that time which the baby is taking the treatment, the baby is not even taking milk. The baby is not taking artificial milk. All the baby is taking is breast milk. So I didn't see anything on milk intake boosting its remedy. I didn't see anything about that. But its remedies are slow and they take a lot of time, because even the surgery method, the baby has to put on these shoes, those shoes which are created to adjust the legs for a very long time for the legs to actually be okay. So milk intake cannot directly boost its remedy, because children who have these defects are usually taken care of before they are even grown. And even for children who are grown that are undergoing this process, I didn't see anything about milk. Maybe I don't know about it. Maybe I have to do more research about it, but I didn't see anything about milk directly being related to its remedy. So any more questions? Lady Giselle, I'm waiting for you. If you don't have any more questions, please let me know so I can leave you for you to get back to duty, and I can get back to mothering duty. Yes, one of the underlying factors is the baby's position in the womb. Yeah, the baby's position can cause position foot club, but that is not a very severe one, as it can be rectified very easily. Waiting for more questions or contributions. Okay. Thank you so much. I'm so happy when you're around, because you always have questions. And with these questions, we learn more. So I really like it when you're around, because you are one who always has questions. Thank you so much for joining. Do have a beautiful evening. And to everyone who joined, thank you so much. Do have a beautiful evening, and may God bless you all. It's bye-bye for me. It's hard to say bye-bye, but I have to go so that you can get on to do what you're doing, and I can get on to do the stuff that I have to do as well. So have a beautiful evening and stay blessed, you all. And hey, remember to keep studying. When we talk about a certain topic, don't just listen to us and stay there. No, go do your own research, okay? Go and do some research about the topic so that you can know more. It is very, very important that you know more about the topic. We cannot talk all about it in this short time. We can just give a summary and maybe click something in your brain to make you to want to learn more about it, because in everything that we seek to discover about the topics before we talk about them, you cannot just learn about it in the 30 minutes or 50 minutes which we are going to talk about it. So go on, do your own research. As a mother, we have to research. So that's all I have for you today. Do have a beautiful, beautiful evening, and God bless you all. Bye-bye.